As Sally said, my name is Crystal Strong, and I'm with the South Carolina Department on Aging. And I run a program called the Senior Medicare Patrol Program. In addition to that, we also have the SHIP program, which is the State Health Insurance Assistance Program. And I like to say that that's all things Medicare. So my particular division, we do it all. You need help getting into a plan, getting out of a plan, something's happened and you've been scammed, we help you with that as well. And in listening to Bailey just a few minutes ago, she touched on a lot of things that we actually tell beneficiaries as well. So as they mentioned, today is the last day of open enrollment. Whew, I'm so happy that is occurring. It's not over yet, but we're here. But with that, with Medicare, there are a lot of questions that pop up. There are a lot of commercials. And I know everybody has seen some type of commercial in reference to Medicare somewhere, whether it's that the people that come up there, the stars, the actors, the football players. There's now one with a little lady named Mary that's enticing you to get into some programs or telling you about some programs that you may potentially be eligible for or extra benefits that you're not aware of. So today I'm just going to touch on a lot of the scams that could be out here, or even if they're not scams, potential fraud, errors, or abuse. That goes all in line with what we do. So as we said, 'tis the season to avoid Medicare scams. So these are just a few of the ones that I'll talk about. And then I also added some others too. So let's go ahead and get started. Make sure my screen is going. All right. Open enrollment. We just mentioned it is open enrollment time. So there are a lot of people that are out here selling products in reference to mainly Medicare Advantage plans. Although open enrollment for the initial enrollment for everyone is ending today, there's also another open enrollment, thank goodness for the federal government, that will start in January. So people who have gotten into plans that maybe need to get out of it or they want to switch to another one, there's another opportunity to do this come January. So January through March, you'll see another enrollment. So these marketing people, the people that sell insurance, are not gone away and they will still be out here. So we're just wanting people to be cautious about what may happen. And in the previous person's presentation, they mentioned people calling you on the phone. Medicare does not call you. Social Security does not call you. 9 times out of 10, anyone that's calling you on the phone to ask you about Medicare that you did not initiate that call for is probably somebody trying to scam you and or sell you something. So we want you just to be cautious about what could happen, or if someone approaches you and you did not initiate that call. They can't leave flyers on your door hangers. They cannot go down the street and speak to your friend and then your friend tell them to come to your house to talk to you because it was such a great program or such a great deal. They cannot do that. They need to make an appointment. They cannot cold call you. You need to have been interested in that product in order to be sold that product. None of that can happen. And if you do encounter that, or someone shows up at your door and you did not invite them, then please give us a call. So what else do we have? We get calls about Medicare's, your card's expiring. And if you don't pay a certain amount of money and they have $10,000 fine, then you're going to lose your Medicare benefits. Your Medicare benefits don't go away. As long as you are paying your Medicare premiums, then your Medicare benefit will be intact. And in fact, if you aren't paying your premium, Social Security or whomever you're getting it through, the railroad retirement system, will send you a letter and let you know that you were failed to pay premium, so this is ending. But your benefits are not going to go away if you don't give them your Medicare number. They don't expire, so there's no fine. Don't go out and get gift cards to give this person. And also, we've seen where they've contacted individuals and they tell them that a gold card or a black card is coming. Everybody's got a new card, or the ones that are entering the Medicare system, they're getting new cards. A couple years ago, they phased out your old ones that had your Medicare number on it, which happened to be your Social Security number. And as Bailey mentioned, that you don't want to carry your Social Security card around with you, nor do you want to carry that Medicare card. And so one of the reasons why they issued new cards is to get rid of your Social Security number, to make it a little bit harder for thieves to get a hold of your Medicare number. But lo and behold, people are still giving out that Medicare number. But just know that it does not expire. So don't let somebody talk you into getting something that is not actually going to happen. And I won't go over this because this was already talked about in the previous presentation, but identity theft happens along with Medicare as well. Once people get a hold of that Medicare number, then now they have a portion of your identity that they can start ordering products. They can start ordering services that you don't ever receive. And before you know it, your Medicare benefits may be gone and you have no idea what happened to them. So just protect your Medicare card as you would protect your money, as you would protect your Social Security number, all of that. Take things out of the mail because you will get inundated. If you are on Medicare or getting ready to enter the Medicare system, that stuff's coming in the mail. I'm not on Medicare yet, and I'm getting phone calls. So just beware of the things that to protect your identity as best you can. Now, some of the types of fraud that they have out here, and you wouldn't think these occur in these type of topics or situations, but hospice fraud. Be sure that your doctor has assessed your condition for hospice. You only get hospice when you are deemed terminal. And make sure that you are checking Medicare summary notices as they come in, or sign up for a mymedicare.gov account so that you can check your Medicare summary notices real time, so that you can make sure everything that you are being billed for and charged for are services that you received. Because some of the examples is that they're enrolled in hospice without your knowledge and permission of the patient or the family. We had that happen in our office recently. My coordinator had someone call and had found out that her Medicare was not working in her doctor's office. When we did some further research, she had been enrolled in hospice without her knowing. It just so happens her spouse was enrolled in hospice and is deceased now, but while they enrolled him, they also enrolled her. She never applied for it, and nor was she eligible for it. So those are things that we want you to look at. I believe it was done in error because they immediately took it out of the system, but Medicare system did not catch it and still had it that she was still eligible for hospice. So if you're eligible for hospice, your Medicare benefits do not work at the doctor's office. And so also with that, billing for higher level of care that was needed or provided for services if not received. Also using high pressure and unsolicited marketing tactics of hospice services. So don't let someone talk you into some service that they're offering that you actually don't need. That's a part of fraud and or I want to say abuse as well. Okay. And so if you think that this has happened to you, just like that lady called us, you can call 1-800-Medicare. You can call directly to our office and speak to one of us to help you with that situation. Also, home health fraud. Home health care fraud. You can get home health if your doctor recommends it, and it's usually after you've been in a skilled nursing facility, basically a rehab center, and you're getting rehab services at home. You left there, now you're still getting some services, and your doctor has recommended that you continue to get these services at home. So what could happen or potentially happen with home health fraud is that they meaning the home health care agency, bills you for services you never got. So they come out twice a week is what your doctor says that you should get. Well, they're billing Medicare for 4 times a week. That's fraud. Or they're billing Medicare for supplies that you never received. Those things are types of fraud. Or getting, they say that enrolled in home health services by a doctor that you didn't know. So of course you want to make sure that it's your own primary physician that does it. Also getting a home health care agency offering you such things like free groceries or a free ride to join their home health care organization. That's fraudulent. Those are things that Medicare is not going to pay for, and that's coercion. So you want to make sure that you're getting into a home health agency or using a home health agency that Medicare is going to pay for, and that they are approved by Medicare. And once again, make sure that you are checking that Medicare summary notice to make sure that you are receiving the services that Medicare is paying for. All right. This is the big time. Scammers are calling. Braces. Says scammers are calling, claiming they're from Medicare and offering you braces. If you get a call that sounds like this, protect your medical identity and, of course, hang up. And I am from the South. I know that people want to talk. They call us and they will tell you everything that you did not ask for. If you have someone calling you, and the first thing that they're going to ask you is, do you have pain? Everybody has pain somewhere, whether your knee, your leg, all the word that they're looking for when they ask you these questions is the word yes, and it is recorded. So as they continue to talk, you've already said the word yes, they plug it in on the back end, and now they end up sending you braces. And people want to know how. Well, you continue to talk to that person on the phone. Nothing in life is free. We all know that. And these braces that you are going to receive once they have your Medicare number, they are not free. They cost thousands and thousands of dollars. And what I should have started off with the presentation is that Medicare estimated loss to Medicare for because of fraud, errors, waste, and abuse is $60 billion. That's B as in boy, dollars per year. That is a whole lot of money, a whole lot of money. So we want to make sure that we protect the Medicare system. So if you did not initiate that call and someone's calling to ask you about some type of equipment, such as braces, back braces, knee braces, all of those, and you did not ask to be called, please hang up. And definitely do not give them your Medicare number, because once that Medicare number is given, they are definitely going to bill your Medicare. And until it actually occurs, there's not a whole lot we can do on our end until we actually see it, then we can act. We may be able to flag your account, but it's best that you don't give out your Medicare number, because when you do and your account gets flagged, then it causes other issues at the doctor's office and or with hospital services. So that's something that we don't want to happen. All right. Therefore, this braces falls in line with durable medical equipment as well. So make sure that if it's a loved one who you used to take care of and you're still getting bills and things from them, make sure that they're not billing your loved one's account if he or she is no longer with us. Make sure all of the things have been stopped when he or she is no longer here, they are deceased. You shut their Medicare off. If you continue to get something or somebody's billed on their behalf and you happen to see it, make sure that you call us, because that's fraud as well. Don't accept COVID or genetic tests from unsolicited calls. People will call and offer you free tests. As I just mentioned, nothing is free. These genetic tests cost. COVID-19 screenings and tests actually cost. The beneficiary may not have to pay for them, but they are billing Medicare for these things. And genetic testing fraud occurs or is advertised as cancer screening tests that you may get, hereditary cancer screening, DNA tests. If these are tests that you desire and these are tests that Medicare will pay for, please go to your physician and request the test so that he or she may give you the proper test that you need and or want, and you know then that it was billed correctly, because it becomes identity theft once you give out your Medicare number, of course, because they're going to start billing not only for you, now they have your Medicare number, and they start billing stuff for everybody else. One of the things that caught my eye when I was putting this presentation together, one of the cheek swabs on a genetic test where they say is free, but Medicare actually pays for it. That test the amount is charged is $2,308.74 for a simple cheek swab. Medicare reimburses at $754. So they charge that much, but Medicare, if it's been approved and the coding is correct, Medicare is going to give them $754 for a test they told you was free. Probably didn't cost you anything, but they're going to bill your Medicare for it. So again, we keep harping on it. Protect your Medicare number. Do not talk to people on the phone that you did not initiate that call for. All right. Ambulance fraud. This occurs when ambulance was not medically necessary and another automobile could have transported you safely. When they mention also billing for miles that travel for support, billing for non-emergency trips as emergency trips. So when you call an ambulance, and this is what we tell beneficiaries when we are doing presentations, when you call that ambulance, make sure it is an emergency that you need to go in it. Because if they get there and it is not an emergency and you decided you didn't want to go, you're going to be billed for that. Also, in the fraud scheme of things, if they take you and it started off as an emergency and then later on you're in the ambulance and you're up talking to them, they could still bill Medicare for an emergency visit, but in actuality it wasn't. You could have driven yourself in a car, but now since you're in their ambulance, they're going to bill Medicare at a higher cost for something that could have actually been prevented. Billing for transportation from your house to a non-covered destination not connected with a hospital or skilled nursing facility. Medicare does not pay for transportation, basic transportation. If you're in the hospital and you're going from the hospital to the rehab center, and it's because maybe you're in traction or something, so therefore you can't sit up in a car. Can they transport you that way? They can. Is that paid for by Medicare? Yes. But any other transportation usually is not covered. So if they built it, whatever that transportation service, and they built it so that Medicare could pay for it, that's considered fraud. And there's the billing for more miles than traveled. It's only 10 miles to the nearest hospital, but they billed something else or took you somewhere else that they shouldn't have. In an emergency situation, they're bound by law to take you to the nearest health facility that can assist you in the crisis that you're in. So they should bill for the correct mileage. If you notice that the mileage is off, then please contact Medicare. Sometimes it is in error, and we don't ever want to say that a supplier is fraudulent. We want to say, first of all, that this was an error. So call them and find out. And if in fact they are insistent that it is not, then that's when you want to give us a call and or Medicare to make sure. Okay. All right. Prescription drug fraud. This with prescription drug fraud, it is billing Medicare for prescription drugs to include refills that were never picked up, delivered, or prescribed. If you place a prescription in the pharmacy and you never go pick it up, the pharmacy is required to put that medication back and not bill your insurance. If you don't pick it up, your insurance should not be billed. If you notice that that occurred, that is fraud. Even if you call them and if you never go get it, that's what they're supposed to do. And you call and you tell them you don't want it, they're supposed to put it back as well. But if you notice that your prescription drug plan has been charged for medication you never received, then that's fraud. Billing Medicare for prescriptions like controlled substances such as opioids that were prescribed by a healthcare provider that you've never seen. If you notice some person's name on your Medicare summary notice that you never gone to, or under your Medicare Part D prescription drug program, you notice on your EOB when they send it to you that this medication was prescribed by Dr. XYZ, and you go to Dr. ABC, that's fraud. Definitely fraud. That goes for the same for those back braces. That's how they get them billed. If you notice on your summary notice that a doctor in Florida prescribed back braces for you and you live in South Carolina, that should be a red flag. If you've never seen that doctor or talked to that doctor, then that is a red flag that is fraudulent and should be reported, because you may actually need those items, that back brace or prescription medication, and because it was already given to you at a certain time per your Medicare summary notice, you may not be able to get it, because that means somebody stole your information or got your information from you, billed your Medicare benefits for a brace that you didn't actually need at that time. And now a couple months later, you do need it. You're not going to be able to get it because Medicare says they've already paid for one for you. The same thing with medication. If it's within a certain window and that's medication you actually need, but it has already been prescribed, you will not be able to get it as well. So that's why we always want people to take a look at their Medicare summary notice, because that shows you what has been charged, what Medicare paid, and what you could financially be responsible for. In addition to the prescription drug fraud, a pharmacy that intentionally provides less medication than prescribed. How many of us actually open up that container when we go to the pharmacy and count the pills that you're supposed to get? And I don't know if it's because of what I do and have been doing forever, but I do. I open up mine and I count them to make sure that if I have a 90-day supply, I got a 90-day supply in there. If it's 30 days, then so forth. That's something that you should do. And I don't think a lot of people do that, because you don't want to get a 30-day supply and you're not supposed to pick up the next one till 30 days later, and you realize you only had 25 pills in that bottle. A lot of that occurs with these opioids. And they may get your Medicare number and now they've got opioids in your name, or you get the opioids and they're not all that's supposed to be in there. All of those things, because we found out that, and we all know people get medications, these medications that you're prescribed, that such as controlled substances, people are selling them on the outside. They get them prescribed, but may not actually need them. And then they end up selling them. We have a case in our office right now. I just received it this week, where a gentleman called, and he was not anonymous. He gave us everything to tell us that he knows of someone who is not only on Medicare, but getting assistance as well in paying for his prescriptions, who's getting some controlled substances, and he is not using them. I don't know if the doctor is along with this or the doctor is aware of it, but the patient is getting the prescriptions and he is selling the pills. I don't want to say on, let's say the open market, as you could say. And he is selling those pills for $15 each. $15 a pill at 30 pills. I think that's, I forgot even how much the amount was. I want to say it was like $1,800 for medication. That's illegal. And if they're caught, you could potentially lose your benefits. So that's one of the ones that I per se am not investigating. That's higher than me, but I've sent that up to the federal government, and now they're going to investigate this to see how true it is. But those things you want to be cautious of. One, you want to make sure you're getting what you are actually paying for out of your own pocket. And two, with that, make sure that you are not doing the illegal activity of selling your prescriptions, because you could potentially lose your own benefits for it. And just know that a company offering you free or discounted anything is probably fraudulent. If it sounds too good to be true, 9 times out of 10, it is. So that's actually all that I have on the Medicare side, just some schemes, scams, and potential fraud to look for. And one thing I really like the slide that I found on our site is to give thanks, not personal information. Report medical identity theft to us, and also if you see it, say something. If it happens to you, do not be ashamed to report it, because certain things happen to all of us. And we want to make sure that if you earn those Medicare benefits are there for you. Open up your Medicare summary notice. Even though it says this is not a bill, just make sure that everything that you've been charged for, you actually receive. And that's all that I have. We also, oh, I forgot my slide. We also take volunteers. So if you're interested in joining the program as a volunteer, please give me a call. This next slide has all my personal information, and I'll hook you up with the coordinator for that region if it doesn't happen to be here in Columbia. All right. I thank you for your participation.
Hey, that's great, Crystal. Thank you so much for all that really good information, a lot of which I would not have known about myself if you hadn't pointed it out. And I think one of the most important points that you made is how everyone should look at their Medicare summary notices. You know, you get a lot of those, I'm sure. But not only just looking at them, making sure everything's correct, but if there's something that is an error, reporting it right away, you know, as you mentioned, because you know, I think sometimes people think, well, that's not, you know, that's not correct. I didn't do it. I didn't, but they don't report it.
They don't report it, exactly.
Yeah, and so if it's not correct and you don't report it, as you said with many examples, then that may be a benefit that they're not able to access later because it was shown on that notice, but
that you got it, exactly,
and you didn't do anything about it. So look at the notices and report anything that is wrong. Well, that's so great, and we really appreciate everything the Department on Aging for South Carolina does for our citizens. You guys have such great knowledge about this and other subjects, and you're always willing to share it as you have today. So we really do appreciate that.